Coming to you at the close of the 84th Scientific Sessions here in Orlando, and wow, what a meeting. I mean, there was so much information, so much great science, networking, people together. I don't even know where to start, so I've brought some of the ADA leaders to talk about some of the exciting things that we heard at this meeting. So Barbara, what did you find interesting here at Scientific Sessions?
A lot of things, especially being a diabetes care and education specialist. I found it very useful to see other disciplines involved in the diabetes care, like dietitians, nurses, pharmacists.
The team.
As a team approach. So it's just taking the research that we have, the innovations, but involving everybody in it as a solution. So I felt very included in the research and representation with all the information that has been presented.
Oh, great. And I know there was, there's a great talk about sort of the pharmacist role and how they can be members of the team. The team keeps expanding because we need more and more people to help us tackle diabetes.
Exactly, and I hear a lot of people saying, I'm a generalist. Diabetes is not the only thing that I do in my clinic. It's true. And then many times for people with diabetes is not their priority. So what's nice about this meeting, it allows us to figure out how do we address the diabetes when organizationally, healthcare-wise, people with diabetes might not be a priority. We have this fascinating research. How do we apply it and put it in practice, which was the key.
That is the key, right? Because we know that there's so much knowledge here, and yet if it's not put into practice, it doesn't help people with diabetes.
Exactly, and as a dietitian, I was really inspired by several presentations about nutrition.
Yes.
Like for example, produce prescription. We can prescribe produce
yes.
There's actually research and it's validated in terms of like how it improves clinical care outcomes in people, if people grow a simple thing like a garden. And it brings community together. So it's actually a clinical intervention. Another thing that I found very interesting was gamification. How do we gamify, how game becomes a therapy? How not only...
We learn better through using the games. And yes, sure, because we all like to play.
Exactly.
And, yeah, right.
Which was surprising because I didn't realize that it's actually applicable for adults. It's just a different methodology is needed for approach. But it's the same thing. There are tools that deliver specific outcome, and it's learning about them and how to use it in practice.
Great. Well, thanks so much, Barbara, for talking with us.
My pleasure. Thank you.
Hey, Kevin, great to be here with you. What caught you at Scientific Sessions this year?
You know, there are so many things that were exciting to watch. I have to say, for me, as a primary care doctor, I thought that the Scientific Sessions were increasingly focused on things important to primary care. You know, as an example, we had the 7 major primary care organizations up here on stage together talking about what diabetes primary care should look like. I've just never seen that. I think it's a kudos to the ADA.
I think it's historic, right? I've never seen like all 7 lined up on stage together. Like that's something.
There was excitement in the audience. It was able not only to define what we should do, but we're able to kind of identify the people that don't do primary care, and that's important. And increasingly in the time when we get some of the people trying to edge in here, people are selling online drugs or fake drugs even.
Yeah, that's a big concern, right?
It is.
Right.
We have such popular and such an impact of some of the new agents, the GLP-1s and other incretin agents, that it's important for people to help people understand when is a person not really a primary care doctor.
Yes, right, yes. Yeah, and we see like a ton of that, and sadly we're hearing stories of counterfeiting and all of that.
Yeah, I'm afraid we are. You know, but the other things too, we addressed cardiovascular disease and kidney disease, sleep apnea. There was just so much that affects the practice of a primary care provider that I think it's becoming a really relevant meeting.
Yeah, I mean, a lot of the trials and information were things that you could imagine implicating in practice right away. And certainly the conversation you all had of the 7 societies were What should people expect? How should primary care deliver the best diabetes care?
Well, you know, that's a wonderful question, and our primary care council is helping provide a strategic perspective of that. In fact, they're helping us, and as you know, of course, we're creating this primary care alliance.
Yes.
And that's going to have an impact. We're looking for 5,000 practices that'll be working with us in helping develop what we think is the best innovative, the best care that we see in diabetes. I'm really excited.
That's super exciting, and already, like you know, here we talked about 2,000 practices recruited and building, and I know there was a lot of buzz around that.
There's been a lot of excitement about it. I think it's a wonderful time for us to begin to invest in delivery, and not just in discovery. Discovery is wonderful, but it's less relevant without delivery.
Yeah. We can have all the knowledge, but if it doesn't get to action, it won't help our patients. So, thanks so much, Kevin, for sharing some of your thoughts.
Well, thank you for letting me come and experience this.
Hey, Marlon. So, wow, wrapping up scientific sessions. What were some of the things in obesity that got you excited?
Wow, it was an amazing meeting. So much in obesity. I think one of the things that really caught my attention was how many GLP-1 candidate drugs are in various stages of development.
The pipeline.
It's just exploded. It's you know, we hear about, you know, Mounjaro, we hear about Ozempic, and so, but now we're seeing all these various candidates at different stages of development. A lot of like preclinical and animal studies and early human.
And sort of different hormones being added in.
And different combinations, and then also different kinds of dosing as well. So we hear a lot about, obviously, injection right now, but we're hearing like once daily tablets, for example, to elicit weight loss. And also beyond that, going beyond weight loss now, we're seeing more like benefits, cardiovascular, kidney, and so on.
Yes, right. So those were other big headlines. You know, actually, one that I really sort of latched onto was looking at sleep apnea, which turns out is incredibly common. You know, 80 million people with sleep apnea, and really like the only treatments we have are CPAP, and which many people don't tolerate, and surgery.
Yep.
And here, you know, we were able to see a significant impact, like a reduction of like half in the number of episodes during sleep. So that's pretty profound.
Yeah, can you imagine kind of not having to carry around a CPAP, for example?
Yeah,
you know, I
right.
mean, this is a big device, right?
Yeah, exactly.
And, you know,
and noisy and cumbersome.
And then also too with you know, with obstructive sleep apnea, there's snoring as well and all that. So I wonder how much snoring is reduced.
Yeah,
by
right,
that too,
right.
You know?
Exactly. And then the FLOW trial looking at renal outcomes and and seeing improvements or, you know, prevention of any progression of chronic kidney disease.
What was exciting about the FLOW trial was it was stopped early. Whenever you hear of a trial being stopped early, you know there's
it's
really
such a dramatic effect that they could not continue. It was not ethical to continue this
exactly.
study.
So when that happens, it's incredibly exciting.
Yeah,
incredibly exciting, and that just underscores how important the results are.
That's meaningful. And then the other clinical one was the SELECT trial. They've all got great sort of acronyms, and that one was looking at progression to develop from people that did not have diabetes and whether they would develop diabetes over time, and it really had a pretty significant reduction in essence, preventing the development of diabetes, and that's a whole other sphere of where these medications on the market now could be beneficial.
Yeah, very exciting. I mean, when you think of the benefits of these drugs and then think of all the potential candidates coming in the pipeline, you know, it's very exciting to think of what we'll be having next year, in the years to come.
Yeah, stay tuned.
It's really, really exciting.
Well, thank you.
Thanks, Dr. Bob. It was a great meeting. It was fantastic research, fantastic science. Really enjoyed it.
Hey, Nicole. So one of the fun things at Scientific Sessions was the Innovation Challenge.
Oh, it sure was. It's so inspiring to see all of these young entrepreneurs and innovators in diabetes, because we know that their ultimate goal is to make people's lives better. And I love seeing the early stage, young concepts, and those young investigators too.
Yes, yes. There were a couple that just sort of, you know, were so sweet to see, you know, how meaningful this was for them.
You're so right. I mean, we get the backstage view because
Yes.
we orchestrate the event and then get to host the event. There was a moment when one of our individuals, one of our winners, called Mom from the back of the stage, and that just warmed my heart.
How sweet. And the solutions were really innovative. I mean, anything from, you know, being able to have like a quick handheld thing to like do an eye exam.
Exactly, to cell-based therapy and
for-
a potential cure
For a potential cure without,
type 1.
yeah, without immunosuppressive therapy or anything.
There was a psychosocial element in there,
Yes.
which was beautiful.
Yes.
So many opportunities, even with technology, technological solutions to make their technology work better.
Yes, right, like pumps that occlude and how to detect that early. I mean, you know, we really saw a breadth of different solutions, and the judges were like fantastic. They didn't take it easy on them. You know, they got into it.
They sure didn't.
Yes.
And where else do you get to have an opportunity to be on the big stage
Yes.
at the ADA
Yes.
with thousands and thousands of people in attendance and judges that could really make a difference in your life and your idea? They could really take it from early to market.
Yes, and I was thinking, you know, like afterwards when there was all that conversation, you could see that's where
You could see
the
it
progress
happening.
happens. And then it was fun just seeing the report out from last year's winners and how they've, you know, how the event helped them, how their products have moved over and over, you know, more forward, and really fantastic. So
And the good news is people can expect more on innovation and more in cultivating innovation from the ADA.
yes, that is a big focus of ours. So thanks so much for talking with me about all of this, and excellent.